Colon cancer is the third most common cancer among men and women in the United States. But many people ignore its warning signs. Therefore, by knowing the early signs and symptoms of colon cancer, it can be diagnosed and treated. In this video on parshealthhtv, we are going to be sharing with you 10 of the early symptoms of this cancer. Stick around to the end. How does the colon work? The large intestine absorbs the remaining water and salt after the food passes through the small intestine. The waste material that remains after passing through the large intestine enters the rectum, the last 15 centimeters of the digestive tract, and is stored there until it passes through the anus. Ring-shaped muscles, also called sphincters, around the anus prevent stool from coming out until they relax during a bowel movement. Early symptoms of colon cancer. It is clear that the presence of one symptom alone is not enough for a definite diagnosis. Still, observing several symptoms can be a warning sign for colon cancer. Sometimes the symptoms of colon cancer may not have progressed, and the person will not notice it. Because in most cases, colon cancer symptoms are silent, and the disease is not diagnosed in the early stages. According to studies and people diagnosed with colon cancer, there are some early signs that it is better to be aware of. Digestive problems. People diagnosed with colon cancer look back and realize they often have digestive problems. Although one may be embarrassed to talk about these problems, it is extremely important. People should not be embarrassed to share all the early symptoms of colon cancer with their doctor. Most people with colon cancer admit that they were told to have inflammatory bowel disease before being diagnosed with cancer. Large or irritable bowel syndrome or other bowel-related problems. Changes in the frequency or type of bowel movements, such as diarrhea, constipation, or loose, stringy stools, are also other signs of colon cancer. Excessive fatigue and weakness. People are easily confused between the two words extreme fatigue and exhaustion. People may stop working and get tired while doing work and daily activities. If this fatigue is not resolved by resting and the person still feels tired and bruised after sleeping, it is called excessive fatigue. In addition, extreme fatigue and weakness can be a sign of diabetes. Abdominal muscle cramps. Most people face abdominal pain during their life, and these symptoms, like many symptoms, can be minor and transient. This symptom is also present in diseases such as hemorrhoids and irritable bowel syndrome, which are not considered cancer. However, abdominal pains that started recently and gradually became more prolonged and intense can be a sign of cancer. Rectal bleeding. Rectal bleeding usually originates from the end of the colon or rectum. It is one of the common symptoms of colon cancer. Seeing bright red blood on the tissue after defecation or pink or red water in the toilet bowl can be signs of rectal bleeding. People often attribute rectal bleeding to hemorrhoids, which makes them not seek the initial cancer diagnosis. Any person who observes bleeding from the anus should go to the doctor as soon as possible and treat the matter with him. Sudden weight loss. Weight loss is often a sign of several types of cancer, including colon cancer. Colon cancer can lead to sudden weight loss in several ways. A person may be eating enough, but the disease can change how the body uses food and prevent absorption. Here are some other signs. The feeling of not emptying the bowels after defecation. Cramping or bloating. Nausea and vomiting. Anemia due to intestinal bleeding. Loss of appetite. If you haven't subscribed yet, please subscribe to our channel and press the notification bell. Definitive treatment of colon cancer. Colon cancer treatment, like other diseases, can be successfully treated with early detection. Fortunately, the incidence of colon cancer has decreased in the last 10 years. Treatment depends on the type and stage of colon cancer. The doctor considers age, general health, and some other characteristics when deciding on the best treatment option. There is no single treatment for colon cancer, and options may include surgery, radiation therapy, and chemotherapy. The goal of treatment is to remove cancer, prevent its spread, and reduce symptoms. Surgery. The main treatment for colon cancer in the early stages is usually surgery. If the tumor is only in one polyp, people may only need a polypectomy to eliminate the cancerous polyp. Surgery to remove part or all of the colon is a colectomy. During this procedure, the surgeon removes the part of the colon that contains cancer, as well as part of the surrounding area. Chemotherapy. During chemotherapy, a cancer care team prescribes drugs that interfere with the process of cell division. They do it by disrupting proteins or DNA to damage and kill cancer cells. These treatments prevent any rapidly dividing cells, including healthy cells. Radiotherapy. Radiation therapy destroys cancer cells by focusing high-energy gamma rays on them. A cancer care team may use external beam radiation therapy, which delivers the radiation from a machine outside the body. With internal radiation, the doctor implants radioactive material in the form of seeds near the cancer site. The radiation may also be from high-energy X-rays. A doctor may order radiation therapy as a standalone treatment to shrink a tumor or kill cancer cells. Side effects of radiation therapy may include the following: mild skin changes that look like sunburn or tanning, nausea, vomit, diarrhea, fatigue, loss of appetite, weight loss. Most side effects resolve or disappear within a few weeks of treatment. Sometimes, many signs and symptoms associated with colon cancer may be ignored by people. At the same time, it may be a warning sign of a dangerous condition in them. Detecting cancer in its early stages can save many lives, so it is very important to be ready to recognize the symptoms of colon cancer. Have you ever noticed any of these symptoms? If yes, please share your experiences with us in the comment section below. And if you enjoyed the video, like it and share it with your friends.